How does genetic tracing prevent CF cross-infection? Imagine a team of detectives working behind the scenes to keep people with cystic fibrosis safe. That's what genetic tracing does in infection control. It helps identify exactly which bacteria are causing infections in each patient by analyzing their genetic makeup. This process involves taking samples from respiratory secretions and using advanced techniques to see the DNA of bacteria like Pseudomonas aeruginosa or Burkholderia cepacia complex. By comparing these genetic profiles, healthcare teams can tell if different patients are infected with the same bacterial strain. This is crucial because when patients with cystic fibrosis share the same strain, it suggests that the bacteria might have spread from one person to another. Detecting such transmission early allows clinicians to act quickly. They can implement targeted measures like isolating infected patients, using protective equipment, and enhancing hygiene protocols to prevent further spread. For example, if two patients have identical bacterial strains, they might be placed in separate areas or cohorted together to contain the infection. Genetic tracing also helps differentiate between new infections and those acquired from the environment. Sometimes, patients might get infected from bacteria present in their surroundings, not from other patients. Understanding this helps avoid unnecessary restrictions and focuses efforts where they are most needed. Using genetic sequencing is more precise than traditional culture methods, which only tell us what bacteria are present but not how they are related. This precision allows infection control teams to monitor outbreaks more effectively and intervene before bacteria spread widely. It also supports policies recommended by organizations like the Cystic Fibrosis Foundation, which emphasize the importance of preventing cross-infection. In the bigger picture, genetic tracing complements standard infection control practices like hand washing, disinfecting equipment, and physical distancing. Together, these strategies help reduce the risk of transmitting harmful bacteria that can worsen lung health in people with cystic fibrosis. Overall, genetic tracing acts like a high-tech map of bacterial pathways, giving healthcare providers detailed insights into how infections spread. This knowledge is vital for designing effective prevention strategies, protecting patients, and improving their health outcomes. Always remember, for personalized advice and treatment, it's best to consult healthcare professionals who can interpret these findings in the context of each individual's health.